Community Assertive Treatment, CT. Provide comprehensive and continuous community care to people with a serious mental disorder to achieve the highest level of social integration, quality of life, and interpersonal relationships. Hernandez Monsalve MA 2000, 2002, 2003. The precarious social adaptation and tendency to revolving door of many users can be considered not so much a direct consequence of the disorder they suffer from, but rather the consequence of carelessness in the treatment plan. Difficulties in responding to demands in everyday life, using public transport, handling money, filling out an application, rejecting others, tolerating stress, frustrations, inability to a proper personal relationship. A very important point of the CT scan is to ensure the continuity of care in an active way, avoiding the establishment of pathological relationships of dependence, achieving personal growth. The center of the intervention is the individual who suffers from the crisis, his abilities and qualities, taking into account that he is a social being and therefore the family should not be forgotten, the closest environment, developing the activity in the home, workplace, the street. The pillars of the TAC are the interdisciplinary team composed of a psychiatrist, a nurse, a specialist in drug addictions, and a specialist in vocational labor activities, claiming the role of the occupational therapist, there being a leader, or responsible, designs an intervention strategy for each user. The aim is to ensure continuity in the staff and members of the team. Intervention and availability 24 hours a day, 365 days a year. Avoid abandonments in treatment. Full responsibility in treatment, crisis intervention, and discharge. Intervention in vivo and for unlimited time, working with the natural social system of the individual. Vocational service, job orientation. Family planning, maintenance of an assertive follow-up, avoiding the disconnection of patients. The team assumes the treatment of the user's addictions. When he has legal problems and goes to jail, the team continues to visit him. The areas where they intervene are the ADL, activities of daily living, basic, instrumental, and leisure. Paying attention to families and other social support, as well as their vocational interest and their integration into the world of work. Not forgetting the self-administration of medication, such as psychological counseling. Example of execution areas where community assertive treatment teams are involved. Daily activities, grocery shopping, and cooking, transport use, social and family relations, shopping, and care of clothes. Health education and the prevention of health problems, medical examinations, make routine appointments, sex education. Family life advice and psychoeducation coordination in the social assistance of children, support in the role of parents. Pharmacological support, dispensing medicines, education in self-administration, side effects. Job opportunities, educating potential businesses about mental illness, preparing for a job, pre-vocational orientation, employment support. Housing assistance, help finding a home, guidance in the administrative task for the purchase and sale of a flat, buying and arranging things for home, social benefits, administrative help when filling out applications in social benefits, accompaniment to social services offices. Financial management, planning a budget, solving financial problems, increasing independence with the administration of funds, counsel, problem-solving oriented disease management skills. Substance abuse treatment, substance abuse treatment. There are several communities and provinces in Spain that have been experimenting with this form of treatment: Malaga, Asturias, Madrid, Barcelona.
Experiment and Nuremberg, Spanish.
There are many techniques of organized harassment or gang stalking, psychological harassment, among others. Noises at the door of the target, allusions, repetition of certain words. exaggerated bureaucratic delays. Slander, rumors, hate campaigns. Use of meanie adolescents for surveillance, chivadio and stalking. Simulation of manhunt with cars. Denial or difficulties in basic services. Creation of groups of false victims to misinform and harm real victims. Practices on the edges of human evil. Everything is to destroy the target or victim, one. Some of these techniques, considered in isolation, might seem trivial, but obsessive repetition turns them into harassment. Kind of like the Malay drop. The aim is to